Today we'll be talking about the medicine Tigecycline. Now we must know that Tigecycline is one of the broadest spectrum antibiotic. It can kill so many gram-positive bacteria. It can almost kill all or any gram-positive bacteria. It can kill gram-negative bacteria, and it also kills anaerobes. Now we must know that this is a synthetic tetracycline analog. So this belongs to more of a kind of from tetracycline group because it is an analog to the tetracycline. It can kill the bacteria which are even resistant to tetracycline as well, so that the Streptococcus pyogenes, Streptococcus pneumoniae, Staph aureus, methicillin-resistant Staphylococcus aureus, vancomycin-resistant Staphylococcus aureus, Enterococcus faecalis, vancomycin-resistant Enterococci, most of the Enterobacteriaceae, that is gram-negative bacteria. This can also be killed by tigecycline, and the broad one of the problematic bacteria, that is Acinetobacter. In atypical bacteria, it can also kill Rickettsia, Chlamydia, Mycoplasma, and Legionella as well. That is the reason why it can be one of the excellent choice for pneumonias. So it covers very broad spectrum gram-positive bacteria, gram-negative bacteria, and it kills so many resistant bacteria which are resistant to the tetracycline as well. The problem with the tigecycline is it doesn't respond or it doesn't kill Pseudomonas and Proteus. So these actually don't respond to the injection tigecycline. One of the good thing about tigecycline is very commonly these tetracycline antibiotics, these are removed from the bacteria by the efflux pumps. So these bacteria develop resistance by having or incorporating these efflux pumps, and they remove the tetracycline from the bacteria. So this resistance uh, capability of acquiring this resistance, the affinity is very less with the tigecycline. So these bacteria, they don't have that much capability to pump the tigecycline out. That is the reason why tigecycline can be a very good addition whenever there is a resistance or whenever there is broad spectrum of bacteria need to be killed. They have huge volume of distribution. That is the reason why the plasma concentration are less, because they get distributed hugely in tissues. One of the best thing about tigecycline is you don't have to modify its dose in renal insufficiency, because very commonly patients with sepsis, patients with MORS, those patients who have SIRS, they very commonly have renal damage or renal insufficiency, where we need to modify the dose of so many antibiotics like meropenem, ofloxacin, diofloxacin, teicoplanin. But in regarding tigecycline, we don't have to modify the dose in renal insufficiency. The elimination half-life is around 36 to 60 hours. Now, it is one of the excellent choice for community-acquired pneumonia, complicated soft and skin tissues infections, complicated abdominal infections. The attains lower concentration in the urine. That is the reason why it should not be used for UTI. Now we must know this tigecycline is not the first line drug for these. We have so many good options for this community acquired pneumonia, complicated skin tissue infections, soft tissue infections, complicated abdominal infections, sepsis, MOTS. So these should be always tried first. And if those antibiotics doesn't respond, then only this can be used as a rescue antibiotic or a higher antibiotic. The dosage is 100 milligram, that is given as a bolus dose, which is usually followed by 50 milligram twice a day for up to 5 to 10 days, depending on the response to the antibiotic. So this was all about injection tigecycline.